Hi everyone, my name is Meera Shreedhar, and today I'll be giving a presentation on breaking the cycle, an analysis of teen pregnancy in low and middle income countries. So without further ado, let's begin. Before I dive into the data and statistics of this issue, I'd like to first introduce myself and my personal connection to this topic. Like I mentioned, my name is Meera Shreedhar, and I'll be a rising senior at Oak Park High School in Southern California. For fun, I'm an avid Indian classical dancer and a state qualifier on my school's debate team. More specific to my interests and identity in public health, I've always been deeply interested in exploring healthcare systems both domestically and internationally, with a specific concentration in adolescent care. I'm a first generation American. My mom was born in Zambia and my dad in India. And because of my diverse cultural backgrounds and connections, I had the opportunity to intern with the Zambian Ministry of Health in Ndola, Zambia over the last few weeks. During my time on the ground there, I had the opportunity to speak with several healthcare professionals and visit multiple facilities, talking specifically about the issues that majorly impacted adolescents. Among all concerns raised by both healthcare professionals and patients themselves, teenage pregnancy was repeatedly expressed as one of the most pressing issues in the region. This leads me to the discussion of teenage pregnancy. First, we must understand what is teenage pregnancy. As defined on the screen, teenage pregnancy is when a woman under 20 gets pregnant. It usually refers to teens ages 15 through 19. While this issue is waning in the West, it has only worsened when considering sub-Saharan African regions and low and middle income countries. For example, in the sub-Saharan African region, Kabir 2024 states that over a quarter of adolescents begin childbearing before the age of 18, while this number is 13% globally. This can be further highlighted when looking at the adolescent fertility rate by region, which is the graph on the right. As you can see, there's a stark increase in the fertility rates in countries in the sub-Saharan African region compared to the rest of the world. So today, I'll be highlighting the causes, implication, and future of teenage pregnancy in the sub-Saharan African region, with a special emphasis on my research, experiences, and conversation conducted in Zambia. So, through on-the-ground research and conversation, I've identified three key causes as to why teenage pregnancy is still perpetuated today. Number one, lack of social welfare and support. Especially prevalent in poorer communities, many young women turn to transactional sex in order to receive the vital and basic resources they are otherwise unable to access due to a lack of social and emotional support from the state or from their families themselves. Number two, underage and unprotected sexual activities. Shockingly, many professionals revealed that nearly 7 out of every 10 cases of teenage pregnancy they see are the result of either assault or sexual intercourse involving a minor and adult. This is heartbreaking and points to broader systemic failures in protection and justice. And three, poor sexual education. The rise of technology has made sexual content much more accessible, causing youth to engage in risky activity without understanding safe sex practices. Additionally, many parents avoid having conversation of what safe sex looks like out of taboo or preserving their child's innocence, which in turn just prevents their children from accessing necessary information or contraceptives. Now, why does this matter? There is significant neonatal harm, but such harm extends far beyond the baby and the event of childbirth itself. Firstly, let's kind of take a step back towards before impregnation or unprotected sex. Unprotected sex itself leads to increased risk of contracting STIs or sexually transmitted infections, exposing both boys and girls to diseases like HIV, chlamydia, so on and so forth that are incredibly harmful. Secondly, unsafe abortions are prominent. Many young women seek abortions from unregulated sources, which result in dangerous complications and oftentimes death. Based on 2019 data from the World Health Organization, 55% of unintended pregnancies among adolescent girls ages 15 through 19 resulted in abortion, which are usually dangerous in low and middle income countries. Lastly, social and economic fallout is detrimental. Many individuals are kicked out or leave their child with their parents, resulting in additional household burden, and others are forced into prostitution or informal work to provide for their families. So, as we can see, there is significant harm. Now, how is this issue exacerbated? Through resource limitations, many facilities are actually forced to scrounge for resources, going to partner NGOs or other neighboring clinics. Due to recent funding cuts, this has become especially strained and prevent youth from accessing vital contraceptives, family planning resources, so on and so forth, that they would otherwise have been able to have. There's also a lack of education. Although school is technically free, many youth don't attend due to financial pressures at home. For those that do, there's outdated sexual curriculum promoting this idea of abstinence, which doesn't resonate with the youth of today. There's also very limited male engagement. Many of the interventions target females, but boys are just as responsible for teenage pregnancy, but unfortunately don't have empathy or understanding for the issue. So, how can we mitigate this issue? There are many interventions that we can look towards, but I've listed just a few. For one, we could expand outreach in adolescent friendly spaces. Cultural stigma surrounding teen pregnancy causes communities to ignore or deny the issue, but having door to door outreach with partnering with community leaders and local organizations like church elders or nonprofits and businesses can slowly help shift community mindsets by disseminating proper sexual education and information. We can also train youth and peer educators. Youth often feel judged or, uncomfortable when speaking to physicians, but when they're talking to peers who are they're closer to their own age, it creates a safe and relatable environment for youth to actually ask for the care they need. And lastly, we could deploy more mobile clinics and caravans. Going back to this issue of taboo, many adolescents are fearful of being seen at a clinic by a relative or family member and having rumors spread. But mobile clinics create safe privacy and accessibility for teens, also able giving them access to sort of contraceptives, education, abortions if needed, so on and so forth. So, to conclude, there are three key takeaways from my presentation. Number one, teenage pregnancy is still here. Just because it has declined in the West does not mean it is no longer in existence. It's still here and causes significant harm in low and middle income countries. Number two, we must recognize the root causes and make efforts to solve them. There's a lack of social welfare and support, there's underage and unprotected activities, and there's poor sexual education with parents that treat this issue as taboo. And third, we must break the cycle by using effective outreach. Women and men must be educated on the harms of teen pregnancy, and youth peer educators should make youth comfortable in asking for the resources they need, whether that be contraceptives, abortions that are safe, so on and so forth. So, one, the issue is real. Two, we must address the root causes. And three, we must break the cycle. Here are my references. A huge thank you to a couple of entities and individuals, to the Global Health Leader Conference staff at Johns Hopkins for giving me the opportunity to present this information, to the Ministry of Health faculty in Ndola, Zambia, for giving me the experience that I had in order to present such research. I'm incredibly grateful to you, healthcare heroes. And third, to you, the audience, for listening to this presentation. Thank you, and I hope it was informative. Here's my contact information. I would love to hear your thoughts, comments, concerns, and feedback on my presentation. I look forward to your responses, and thank you for listening.